Pregnancy is a natural process, so if it's not happening or if it's not sticking, something is missing. After having a family member go through infertility and experiencing a miscarriage myself, I realized how little support and education women have around infertility. I want to change that. I'm Dr. Jane Levesque. I'm a naturopathic doctor and a natural fertility expert. Tune in every Tuesday at 9 a.m. for insightful case studies, expert interviews, and practical tips on how you can optimize fertility naturally. If you've been struggling with infertility, pregnancy loss, women's health issues, or you just want to be proactive and prepare yourself for the next big chapter in your life, this show is for you. All right, ladies, today I want to talk to you about detoxification, and maybe your gentlemen partners are also going to listen to this as well. I get a lot of questions around detoxification. Obviously, it's because I talk about a lot of it on my social media and the importance of doing some detoxification before you start trying to conceive. Now, some of you, of course, may already be trying to conceive and you haven't been successful. And when couples come to me, a lot of the times they've been trying for not just 1 year, but usually 2, 3, 4, even 5 and longer. And there's been a lot of things that are preventing their bodies from doing what it's quote unquote designed to do. And I'm not saying that for some couples, they will need IVF, but I don't think it's as many couples as we think it is. And I'm a big believer in doing the prep work before you go into the procedure and you have a very good understanding as to why your body isn't getting pregnant in the first place. And it's getting a really good evaluation for the woman and getting a really good evaluation for the men. So then we can understand the fertility, the male fertility aspect, the sperm quality, and then of course the male's overall health is going to reflect in the sperm quality. And the same is true for the female. A lot of the times, what I find now is most people have no idea what it's like to be healthy. And even though we are doing healthy things, we are trying to do healthy things. We're trying to take supplements. We're trying to eat well. We're trying to hydrate and do the electrolytes and all that jazz. It's not adding up to the results that you want, whether it's physically, your hormones are not balancing, your skin is still breaking out, you're still not losing weight, your period is still horrendous, or of course, it's not resulting in a pregnancy. And so what I've been trying to draw a connection for people a lot on social media is about detoxification and the importance of optimizing the function of those detox organs. So this is what I want to spend some time talking about, because I think it's critical that we do it. The level of toxins that we're seeing in children, in placenta, and in the nervous systems of those kids and how it's impacting their health is, I don't think it's undeniable at this point. The rates of infertility are skyrocketing, and I believe that they're actually higher than what we see, like that 1 in 6 couples is struggling to conceive. There's a lot of people who are struggling in silence, who are not talking about the fact they'll never go to the doctor. They'll never talk about they just couldn't have kids and they just left it at that. So I think it's a really big problem. I don't think environmental toxins is the only issue, but I think it's a really big issue. And we're seeing it, like I said, in our own health, and then the ability to get pregnant and to procreate, essentially. And then, of course, the health of our babies. So I am really passionate about building generational health. I think building generational health, just like building generational wealth, will require you to do things differently than what your parents did and what everyone else is doing. And so I hope that you guys enjoy this podcast and spread the information and the knowledge and take the lead yourself to start down this road, because I don't think it's a matter of if we're exposed, it's a matter of how much and how much we have accumulated and for how long. Have we had exposure since birth? Have we had exposure since being young kids? And how well are your organs of detoxification functioning to be able to maintain the energy and the vitality that the body needs to then make hormones, have enough nutrients to rebuild cells, repair tissue, repair DNA, and therefore have a healthy pregnancy and a healthy baby. So first things first, detoxification is a natural process that happens in the body. I've had to unfollow a couple people that they were like personal trainers, and I just really liked their content. I thought they were funny, but then I could see them stand up and say that if anybody's telling you to detox, run away, you have organs of detoxification, you don't need to worry about it. It's the craziest thing I've ever heard. I think it's the craziest thing I've ever heard to say, well, you have detox organs, you don't need to detox. It's like telling a diabetic, well, you have a pancreas, why do you need insulin? Because it's not working well. That's why. And all of the symptoms that you have, including infertility, are tied to, in some way, shape, or form, to poor function of detoxification organs, because your organs of elimination, organs that help to eliminate things out of the body, is your guts, your lungs, your liver, your skin, right? Lymphatic system. Even when we're crying, when we're breathing, when we're sweating, we're getting things out of the system. And of course, your kidneys. So when you're peeing, anytime you pee, you poop, you sweat, you cry, you breathe, your body is trying to get things out. And what's happening right now in the world is there's too many toxins, and the body's overwhelmed with how many toxins are around it. And so it's just trying to push it in every way, shape, or form out of the way to protect the vital organs. But then what's happening is we're seeing a lot of toxins accumulating in the fat. So if you have weight loss resistance, it is going to be tied to environmental toxic load in some shape, way, or form. And then, of course, if the liver is overburdened, if the guts are overburdened, then you're not absorbing those nutrients. It takes more nutrients for the body to process those things. And so it just kind of becomes this hot, big mess. Point being is, in our day and age, you have to learn how to detox and how to keep your body clean. And if somebody says otherwise, I think that they're missing a whole piece. Now, maybe they don't need to detox because they've been eating well and they're taking supplements, but even those supplements in probably some way, shape, or form are supporting their liver, their gut, their energy, so their mitochondrial function, the lymphatic system, maybe they're sweating. I'm very careful about listening, obviously, advice on the internet. And I know that you guys are listening to my advice on the internet, but I always consume content with a grain of salt. And what I'll invite you to do after, if things are resonating for you of what I say, then reach out, check out to see if I'm the right practitioner to work with you, and what, if you like what I'm teaching. And I'm always sharing based on what's working for me. And I share what I do and how I look and what my kids are doing and how I feel every day. And I share my data because I want to show you that I'm not just telling you what to do, I'm also doing it. And I'm doing it with my patients, I'm doing it with myself, I'm doing it with my family. And so it's not just talking the talk, it's also walking the walk. So when you're thinking about listening to advice on the internet, make sure that person is walking the walk. They're not just talking the talk. And a lot of the times people are not sharing information. Like, they're not sharing their lab work. They're not going to share their data. They're not going to share their ups and downs. They're just going to tell you stuff to do. So just be careful to listen to that, is the whole point. But detox is something that's happening all the time. So that's 100% right. The detoxification process is always happening 24/7, 365 days a year. When I'm talking about supporting the organs of detoxification, what I'm talking about is turning up the dial. So decreasing the amount of toxins that are coming in, and then increasing the speed that those toxins get out of the body. And so I always say that there's two components to detoxification. One is you have to decrease your environmental toxic load. The big hitters are going to be your water, your food, your air, things that you're putting on your skin. Those are, I don't want to say non-negotiable, but you should be aware in figuring out how to clean up that environment on a regular basis. Because if you're drinking water that's not very clean, your kidneys are going to struggle, whether it's exposure to heavy metals or through parabens or PFAs, so the forever chemicals. Those are all endocrine disruptors. You're going to have a hard time making healthy hormones yourself, not to mention that now your body has to use nutrients to process those hormones instead of repairing the cells. So that first component is you always have to make sure you're working on decreasing the load. It's not about getting 100% exposure, removal of exposure. I just don't think it's possible in our day and age, but you need to be aware, because a lot of the times people are not aware of how exposed they are to toxins. And just changing out your, face cream, it's better than nothing, but that's not going to move the needle enough, because it's just one product that you put on versus the air that you breathe throughout the entire day, what the water that you're drinking, if it's 3 to 4 liters a day, how much food you eat, right? Like, we have to be aware of how many toxins we're exposed to and doing the best that we can, minimizing that exposure. So that's always the first step. The best thing to do is to avoid toxins. And when I first got into naturopathic school and into naturopathic medicine, that was enough. That's what people would say. That was enough. I don't think it was really enough back then, but we were told that was enough. If you just avoid the exposure, then the body would get rid of it. And the truth is, it does get rid of it, but because there's been such a big exposure, it's struggling. And that's why we're seeing a huge decline in the health of the population and fertility rates. And so then the second component is increasing the speed that these toxins are hanging around for. So I like to use the bathtub analogy. I talk a lot about this with my patients, right? You're a goldfish swimming in the bathtub. There's a shower head with water coming in, there's a drain, and there's a sewer. We can all agree that if the water in the tub is really dirty and mucky, that fish is not going to feel very good. And so the fish is you're swimming in that water. And so if your environment is really dirty and mucky, the conventional system will just say, well, just give yourself some medication to increase your energy, to get rid of your anxiety, to get rid of your depression, to start whatever. And then you're good. You don't have to change anything. I think it would be nice, but that's not how it works. So the holistic approach and the alternative approach and what, I come from, it's we need to clean up the environment. If that, we can all agree, if the water is clean, if the tank is clean, that fish will be really happy. And so I say it's the bathtub analogy versus just the tank, because I like to use the drainage aspect and what I've learned from Cellcore and what I've used, in the last 3, 4, 5 years. We don't just need to put clean water into the tub. We need to make sure that drain isn't clogged. And the drain is literally your organs of detoxification. This is your liver, your gallbladder, your kidneys. For ladies, it's the menstrual cycle. For males, believe it or not, your seminal fluid will become this toxic dumping ground if the other organs aren't working well. So if you're not pooping on a regular basis, you're not drinking enough water, you're not sweating. So the drain is this, I imagine it as the liver, the gallbladder, the kidneys, the menstrual cycle, like I said. And then the sewer is obviously the guts, the colon, and making sure that things are moving through efficiently instead of hanging around for a long time and basically just fermenting and creating what are known as endotoxins. So it's internally created within the body. It's this dead bacteria that's hanging out and just kind of dying off. And that's why we feel the bloatiness and the gassiness and the stools that are really stinky. And generally just feeling unwell. So we want to make sure that water coming in is clean, but then we want to make sure that the drain is moving, because even if the water is really clean, but the drain is clogged and the sewer is backing up, that water is still going to be mucky. And so I find what I teach through my detoxification process, and I teach a 10-week detox as a general, like everybody should do this. Everybody would feel better if they did this. And the detoxification aspect doesn't really start until the last 2 weeks, because the first 8 weeks we're talking about, okay, we're going to do the jumpstart diet and we're just going to start increasing drainage and increasing energy. And then we're going to support the gut, and then we're going to support the liver for a couple of weeks, and then we're going to support the kidneys, and then then the body is primed. Most of us think of detoxification as a very short-term thing, versus it's always happening in the body. It's just a matter of supporting it so that you decrease the load and speed up the process. That's all it is. And the way that, for example, I'll teach my patients to decrease the load. Yes, you want to make sure you're drinking clean water. Get an air filter in your house. I love the Jaspers. I have the Jaspers in every room, in the kids' room when they're sleeping. It's the amount of times that they're getting sick now is almost like, it's insane to me. They don't get sick anymore because if they're sleeping for 10, 11, 12 hours a night in their rooms, 12 hours out of the day, so half of the day, they're breathing the cleanest air possible. And I think that I underestimated the difference that has made in all of our health. So then it's the quality of the food, but then it's also the types of foods for you. So right now my husband and I are doing gluten-free. We did some testing. Both of our wheat markers came up really high. And even though I don't feel bad when I eat wheat, I can't deny the data. And so obviously I tell my patients to cut out gluten when I see markers like that. And so I'm just practicing what I'm preaching. And I said, okay, we're going to cut out gluten. And I I don't want to say surprised, but like, I feel very different. And when I had a piece of bread yesterday, because we didn't have enough whatever, and I'm like, you know what, I'll just have, and it's sourdough and it's homemade and it's really good flour, but I could feel the stickiness of the gluten in my guts, in the kind of a little bit of the inflammation that created for me. And I didn't really notice that before because I was just eating gluten on a regular basis because I was eating such high quality. To me, I didn't notice that big of a difference. But like I said, this is where I rely on the data. So the decrease in load is also not just the quality of the food and the environmental toxin, but some of the things that could be inflammatory for you. So I know raw dairy has been huge for people, and we actually had access to raw dairy for a little bit. And I realized that number one, we just don't drink that much dairy, and I do not want to commit to, a gallon of dairy a week. And number two, I still don't think it's good to have that much dairy for any single person, even for kids, to just be drinking glasses and glasses of milk. I think that there's a lot more cons than pros to dairy, especially in those large amounts. And so sometimes it's things that you think are good, they're maybe not as good, but decreasing that inflammatory load. Another way is to decrease the amount of times you eat. So if you're used to eating 3 meals and a couple snacks, and then you're not doing any of this intermittent fasting in between where the body actually gets a break and your blood sugar is constantly spiking, that's inflammation. That's a load on the body that it has to now process, and it doesn't get a chance to repair itself. Instead, it's working on either processing the toxin or getting rid of this inflammation that's now being caused by the intake. So point being is we want to decrease that load as much as we can. And then we want to support the drainage. And so when I'm supporting, and that's the first thing that I do, and support the organs of elimination, the simple process is, hey, I do a minimum of 10 weeks, but really the 10 weeks is so long that after that, people don't even really remember what it was like not to eat vegetables, what it's like not to have fiber, what it's like not to have. And yes, you can have the sweets or a special occasion treat, but for the most part, because your body now is used to having clean fuel, you will start to crave clean fuel. And that's kind of how I, quote unquote, trick you into doing those longer lifestyle changes. Because like I said, detoxification is always happening. It's just a matter of turning it up a notch, because we're trying to speed up the process of repair, like tissue repair, DNA repair, cell repair, and increase those antioxidants so they can go towards reproduction instead of just putting out fires, right? If the body is inflamed, if you're carrying extra weight, if you have a bunch of acne, it's like that's inflammation. So all the nutrients that you're taking, the body is going towards trying to figure out how to manage this inflammation instead of towards the reproductive system. So that's kind of I don't want to say the first question, because I know that was a lot, but a lot of it is everybody needs to detox. It's just that how much do you do it and how often really depends on what's going on for you. This is where I do run environmental toxic panels. Sometimes we do need to look at heavy metals and look at provocation and pre and post provocation to see how much your body is excreting, and doing much longer detoxification when it comes to heavy metals. But usually parasites are going to come with that. Usually there's gut dysbiosis and other things that are coming with it you need to address first before you can get into the heavy metals. But heavy metals can cause a lot of issues for fertility for both males and females, and they do. And they cause a lot of issues for little nervous systems that are developing, aka the embryo and the fetus, and then once the baby is out. So this is something that I just have a conversation with each of my patients and see what they're comfortable with, because sometimes we don't have to go into doing all the deep diving into the heavy metals. Sometimes it's enough to just optimize the organs of function of detoxification, optimize those organs, and then just provide lots of nutrients. Sometimes it's enough, and sometimes it isn't. And it's really a case-by-case basis, I think, for the couple together, as opposed to just for the woman, as opposed to just for the male. But if you're thinking about having kids in the next 1 to 2 years, I think that's a fantastic timeline to start doing some detoxification, because there isn't this pressure of like, we need to do this as fast as possible. Because let's face it, there's certain things we can try to speed up, but certain things you can't. The body is just going to work the way that it's going to work, and you can't speed that up, and you have to respect the process. But ideally, you would give yourself a minimum of 3 months, and 6 to 12 months is perfect in my opinion, where we can have a huge impact on the quality of the egg, the quality of the sperm, the quality in general, like how you will feel work with organs that are working well and with good nutrient levels. You're just going to be a completely different person, and in the best possible way. And so that will reflect into good fertility. When we're optimizing fertility, we're optimizing health. When we're optimizing health, we're optimizing fertility. I think those two things go hand in hand. The last thing that I'll talk about when it comes to detoxification is supplements. So supplements are there to supplement your diet and lifestyle choices. I think that supplements in our day and age are necessary. And the way that I organize my supplement protocols, kind of the bird's eye overview, is you need something that's going to bind toxins. It's not a matter of if you're exposed, it's a matter of how much. Cellcore, in my opinion, they have the best binders, and they have 4 different binders, and they're set up for 4 different reasons. And so it's your practitioner is going to know what to do, but it's having a binder in your protocol, I think, is a non-negotiable. And I keep all of my patients on binders when they're pregnant. If you are pregnant already, I do not start new things in general because we don't want to stimulate anything. But like I said, I was on binders for the second pregnancy because I didn't know anything about it in the first and loved it. I think it's just like it's the new multivitamin. Everybody needs to be on a binder. You need something that's going to help to support drainage, support your kidneys, your liver, your gut function. And whether it's things like enzymes that just helps to break down the food and actually for your body to absorb it, or things that will help to speed up your constipation if you're constipated, or things that will support your liver function or your kidney function, lymphatic flow. We need 1 product, 2, 3, sometimes 4, depending on the situation, to help support that drainage. And then there is the rebuilding and repairing, because damage is always being done in the body. So we need a binder, we need something that drains, and then we need something that's helping to repair and rebuild the cells, mitochondrial health, the health of the cell itself, the cellular, it's the proteins, it's the fatty acids that are going to help to build that up. And of course, minerals, nutrients, B vitamins, all that stuff that helps to really the process of the cell to work and function smoothly. Now, you have to remember, and this is what maybe you don't remember because it's the first time that you're hearing this, but nutrient deficiencies are not the root cause of anything. So if you have low iron, if you have low B12, if you have low vitamin D, it's not root cause. The toxicity or a pathogen is what's going to cause the deficiency in nutrients. And so I always supplement the nutrient because we need the vitamin D to help bring the energy up. We need the zinc to help support the immune system and 300 other functions in the body. We need the magnesium, we need the B vitamins. But if we don't address the root cause at the same time, you're going to be dependent on these nutrients for the rest of your life. And eventually they stop working. You need more of them because you've never overcame the pathogen or the toxicity. For example, heavy metals. Heavy metals will leach minerals out of your body. And so depending on the heavy metal, it will leach different minerals. And so if you have heavy metals that are unaddressed and you constantly need to take minerals, obviously take the minerals because it will help the situation. But the root cause is these heavy metals that you have to get out of your system. And the same with whether it's a pathogen like parasites or a bacterial infection that's chronic, or yeast, candida, mold, fungus, right? Those viral infections. It's really, really important to understand the root cause and treat the deficiency from a place of I'm getting rid of the thing that's causing the deficiency, as opposed to let's just take these nutrients, let's just take these vitamins, and my problem will go away. And I think there's a lot of practitioners out there who treat like that. And this is why I have my podcast, because I want to educate you guys. I used to treat like that and it didn't work. I didn't have patients who are walking out and be like, I'm so healthy all the time. They felt like things would stop working. And I felt like things would stop working for myself, just addressing the nutrient deficiencies. So you have to look at the toxicities and the pathogens that are driving the nutrient deficiencies. So then the body has the energy to do to overcome the pathogen, to overcome the toxicity. And that's really what detoxification is. Detoxification is your body pulling things out of the cell and then getting it out of the body. Getting it out of the body is the drainage. And a lot of the times we want to support the drainage. We're always supporting drainage, but sometimes just by supporting drainage, you get rid of everything that you're supposed to get rid of. Depends, of course, on the toxic load and what else has been going on and how long you've had it for. But you're always working on drainage. You're always on binder, and then you're doing some sort of rebuilding and repairing of the cell. And that, my friends, is very individual. I know you want me to tell you exactly what to take. I don't know your history. I don't know what the pregnancy with your mom was like, what your mom was like in the breastfeeding situation, what your childhood was like, what your puberty years were like, what was the last 5 years of your life, how long have you struggled with infertility, what are the symptoms that you're experiencing, what's showing up in your gut test, what's showing up in your vaginal microbiome, what's showing up in the environmental toxins. If you're still grasping at straws for, I heard this was good, I heard this was good, just know that yes, you could start taking vitamin D now. Yep, you could start taking magnesium and ubiquinol. You're not getting to the root cause though. And so that problem will continue to persist, and it might show up as infertility, but it might show up as something else later. That problem will continue to persist until you decide that, you know what, I want to figure out the root cause. And I think this is when the practitioner kicks in. Even myself as a practitioner, I've worked with practitioners still because it's really hard to see your own stuff. And when I get my own lab testing done, like I want someone else to look at it to make sure that I'm not missing something, because someone else might have a slightly different perspective. And like I said, it's just really hard to see your own stuff and, you know, what's wrong with it. And there's different ideas. There's research that's exploding. So to summarize it, it's not a matter of if you need to detox. It's a matter of how much. It's both of you need to do it. Ideally, the very minimum, you do something for 3 months, but ideally you'd give yourself 6 to 12 months if that time allows. Obviously, you have to factor in age. You have to factor in how long you've been trying to conceive for and what's going on. But the minimum is 3 months, absolute minimum, where you clean up your environment and you start taking some stuff to support that drainage. So then things can start moving out of the system. And then you're taking the nutrients to help prepare and rebuild those cells a little bit faster. So not a matter of if, it's a matter of how much you're exposed and therefore how much you need to do to prepare yourself. But giving yourself more time than not is better. It's always better to give yourself more time than less time, because life is chaotic. Things are going to happen. You might not have, something else might come up. It doesn't matter. You want to just give yourself the time to prepare. And like I said, if you're already in a part of your journey where you're trying to conceive and it's been a while, you still need to give yourself time to detox, because chances are why you're not conceiving is because of a toxin or a pathogen, and you need to get that out of the system in order for the mitochondria to work properly, and also to make sure that you're not passing it on to the next generation, because like I said at the very beginning, we're seeing the health of the next generation really, really struggle, and the toxic load of what we're seeing in the placenta, in the umbilical cord, the toxin level is really, really high. It's very alarming. So I think if you zoom out, I know sometimes it's like, but I want to have a baby now and the clock is ticking, and just know that 6 months is not going to make a difference. Again, depending on how old you are, but for even my older patients, 6 months is very, very beneficial in terms of the health outcome and then the outcome of the pregnancy versus, it's years. You don't need to take years. You shouldn't have to take years. This is where you will be taking, much higher doses of supplements. You should be working with practitioner. You should be retesting things on a regular basis. And you go basically as fast as your body allows you to reverse the aging process by detoxifying and supporting fertility at the same time, because there is such a thing as depleting yourself through detox. And I've seen that a lot where women were trying to conceive and they have heavy metals. And so they go to a heavy metal specialist, and the heavy metal specialist just drains their system because they're like, well, we need to get this out. And sorry, your minerals are low. You can't then it takes them years to rebuild. We can't do that. We have to be mindful when we're talking about fertility to make sure that we're getting things out, but we're always bringing energy up. And personally, that's how I always do it. Like, I don't care if you're trying to get pregnant or not. I don't think detoxing should be painful, meaning your energy is crapping out, you have headaches, you're breaking out. And it's like, there's almost like a badge of honor, like, oh yeah, I'm detoxing and I'm supposed to have these detox reactions. They should be very minimal. If they're not minimal, it means your body is not managing it and you're probably depleting it somewhere down the road. So I think this is where it's important to work with a practitioner that you really trust, and you're always tuning into your system, because if you're tanking, your HRV is tanking, your heart rate is increasing, you're feeling terrible, that's not a place that you want to conceive from. And it might take a while to get back to feeling normal again. So we want to be very, very mindful. So I hope you guys find this helpful. It's not a matter of if you need to detox, it's a matter of how much. If you want to learn more about it, in my Fertility 101 membership, this is something that I teach and everybody goes through, and I lay out what you need to do week by week. I also lay out the supplements that you should be taking, and you can jump on office hours and ask all the questions that you can possibly have. Of course, there's a group chat as well. But if you are serious about learning how to detox and how the organs of detoxification work, I highly recommend to pop in, join the membership, and see what you learn and how you feel. You going through it and experimenting on yourself is the best way that you could learn and see that most of the times people are like, well, I don't really know if I'm going to feel a difference. You will absolutely feel a difference. If you don't feel a difference, then we missed something and maybe you didn't do enough, but I really hope to set you up for that success, because like I said, I've been cutting out gluten for 2 weeks and I noticed a difference within 3 days. I've known people who have cut out gluten for a month and didn't notice anything. And that's because that's all they did, is they cut out gluten, but they replaced the gluten with something else and they still had terrible gut function. They still had, so decrease the inflammation a little bit, but not enough for them to notice a difference. And so that's what I teach, is you have to do enough things to get the ball rolling, so then you could actually feel the body changing, and then you can become more sensitive to the tiny changes. But at first you have to do lots of changes to decrease the overall load of inflammation and toxins, so then the body can heal, and then you can trust, quote unquote, your intuition a little bit more, because you'll be able to tell. If I walk into a house that has mold, I can tell. If I walk into a house that is filled with environmental toxins because of the cleaning supplies and the plugins and whatever, I can tell. And I get out immediately because I can tell that it's toxic for my being. But some of you might be still living in that environment without realizing it. And so you have to pull yourself out of that environment before, so that you can actually tell that, oh, this is harming me. I was just not noticing it enough. So if that's, click the link below. There's a link to join the Fertility 101 membership. Feel free to reach out to us on Instagram. We're happy to help. Like I said, I hope you guys find this helpful. And detoxing is not a matter of if you need to do it. It's a matter of how much. And I always, always, always recommend to do it with a qualified practitioner, because you can go too much the other way and you can cause some issues. Please don't do a 7-day cleanse where you literally have diarrhea for 7 days. That is not detoxing. That is just you taking a laxative for 7 days and pooping your pants. That is not detoxing. So please don't do that. If you want to learn how to do it properly, click the link down below to join the membership. Thanks so much for being here, and I'll see you next week.